Good afternoon, Earthlings. Hey, so it's Crazy Old Gringo here. Got my Crazy Old Gringo pork pie hat on. Hope you like it. Nah, I really don't care. So, you know when you turn 65, or you're just about to turn 65, you're going to be inundated with all these Medicare ads from all over the place. And you really should start doing some research on what it is that you need to do to take care of yourself. Now, I'm in a couple of special circumstances. I don't know if they're going to apply to you or not, but maybe. Let's talk about it. So, as you know, I'm living about an hour away from the Arizona border, and I'm fortunate enough to be in the VA system, Veterans Administration. No matter what you hear, my experience has been pretty positive with the VA. They've been very proactive with my health. When I go in for my annual physicals, my doctor suggested I might want to consider getting the shingles vaccine, which I did. I went there to get my inoculations for the coronavirus. They have a very prompt system to let you know when you have something coming up. I've been treated well, on time. They pay for everything. The only medications I get are naproxen because I've got really bad knees, and that's an anti-inflammatory. The only issue with it is that, of course, it's a 4-hour drive from here to Phoenix, and that's a nuisance. But since I only have to go once a year, it's not so bad. I don't pay any copays. It's nice. Here's the thing. As you turn 65 years old, Medicare is going to kick in for you. And these days, if you're already on Social Security, Medicare is going to automatically give you A, which is going to be free, and then B, which this year is it's $170 annually. And then you're going to have to make some other choices. You're in Mexico, and you don't have the choices that you might think you do. Insurance is a contract between the beneficiary, which would be me, and the insurance company. About 1 million pages long, so you're going to have to read it to try to understand what it is that they're contracting with you for. When you walk into a doctor or you walk into a hospital in the United States, they're serving you, not the insurance company, so you're 100% responsible for the charges that they are going to levy against you for providing that service. They understand that the services that they're going to provide can be quite costly, so they have also engaged in a contract with insurance companies because they know they're going to get their money in a more expedient fashion if they do that. But still, at the end of the day, you're the one that's responsible for paying the bill. A lot of people don't understand that. They think that the insurance company is contractually obligated to go ahead and pay everything, regardless of the circumstances, and they're not. It'd be best if you did some research about that. Well, here in Mexico, at least in Puerto Penasco, the hospitals and doctors here don't have any kind of contractual relationships with the insurance companies you're typically going to find in the United States. They have their national health insurance, which is for the citizens and gringos that get their green card, their residency card, can avail themselves to the system. Rocky Point is a small, probably still considered a pueblo as opposed to a ciudad, and it doesn't have the medical facilities if you're going to have some sort of catastrophic injury. Now, I've run into some pretty good doctors. There's a dermatologist here that's pretty good. I've ran into a couple of others. And getting your blood drawn and the results back the same day is really pretty remarkable. The prices are extremely cheap, but don't expect that if you're going to have something catastrophic happen that you're going to be able to get treated. A lot of people wind up going down to Hermosillo that live here, you know, for bigger problems. And the insurance companies aren't going to pay here. If you have to go in for gallbladder surgery or something, they may be able to do it, but the insurance company's not going to pay for it. Even if you get expat insurance, even if you get whatever medical insurance that you want, they're not going to pay for it here. Now, later, you may be able to come back to that insurance company and submit your bills, and it's possible that they're going to pay for it. But I wouldn't hold your breath. And that kind of segues into Medicare. There's many videos out there that will discuss whether or not you should stay with Medicare or whether you should go on to Advantage. And if you do a little research, you're going to find that the Medicare Advantage plan is basically an HMO. And what that means is that you're going to have to stay within the boundaries of that HMO plan with their doctors, their hospitals, their clinics, their everything. What that also means is that if you need treatment, they're going to have to approve whether you get that treatment or not. That also means that they can disapprove whether you get that treatment or not. Personally, I don't like somebody else in the mix of any kind of decisions that I want made for myself. Now, Joe Namath and J.J. Walker and several others come on television and talk to you about the benefits of joining an Advantage plan. The benefits for them is that they're paid to make an endorsement. The benefits to Advantage is that the federal government pays them around $600 a month for each patient that is going to join the Advantage plan. And then, of course, it doesn't pay for everything. There's going to be deductibles, annual and doctor's visits and that sort of thing. And if they sell you a gap plan, which is to cover what the Advantage plan doesn't pay, that's another cost. Usually that's covered under the G plan for Medicare. Now, how does the Advantage plans make their money? Well, in part, of course, they're being paid from the federal government, but they make their money by denying claims. The insurance company is going to make money denying claims. How do I know that? Well, I'm going to put up a link here that will suggest to you that the federal government is doing an investigation on these Advantage plans, specifically over denying claims that they should have never denied. I was very lucky that an insurance salesperson was referred to me, and she was patient because I keep vacillating back and forth. What is it I want to do? Do I want to stay with the VA system, which has been good, and it's free, and there's no co-pays, takes care of everything? Or do I want to stay with Medicare? Can I do both? I can do both. I can do both. What about a drug plan? Well, you know, I'm thinking that with the changes that have come up, where you're only going to be out of pocket for $2,000 a year, may not be a bad plan. And for $8 a month for a drug plan, I think I can do something like that. So at the end of the day, I've decided that I'm going to stay with regular Medicare, A and B, and I'm going to get a drug plan, a Part D. I'm still going to go to the Veterans Administration for any of the issues that I have. But my options are also that I have a couple doctors down here that I have experience with and that I trust and that I know they can do things, and the price is crazy. As an example, I had some sciatica, And I went down to this young woman. I don't know her name. I just know where she's at. You can just walk right in, no appointment, which is crazy. And for the price of $2, I think it was, I told her what was wrong. I knew it was sciatica. She gave me a prescription. I went next door to the pharmacy, filled the prescription, came back. She gave me the shot. I took the pills home, and over a matter of 3 or 4 days, the problem was resolved, fixed. What was the cost of the doctor? It was $2 or $3. Yeah. Now what that means is I had to get a referral from somebody that lived in this area forever. Had to use common sense, my own common sense. Now, doctors probably the thing they hate the worst is when you get on the internet and figure out your own diagnosis. But this one was an easy way for me to figure it out, and plus, she figured it out too. I think I went to her for one other thing in the past, minor stuff, just minor stuff, and it's always worked out well for me. I've got another doctor who probably does more. He works pretty closely with the dermatologist, and I would feel comfortable enough for him to become my regular doctor. I think he's probably a bit more expensive. The dermatologist I went to, I think the last procedure I had a little eczema. Might have cost me $50. And she took care of it. She recommended what to get. I got it and took care of it. So you can absolutely be down here in Mexico and get treated for minor normal stuff and feel pretty good about it. It's got a good system in a lot of ways. If you're going to get major stuff, if you're going to be in an accident, if you're going to have other catastrophic problems, if you were Mexican, you would have to go to Hermosillo. If you're an American, then you're going to have to go up to the border. How do you do that? Well, the ambulance here will take you to the border, and the last cost I heard is around $800 for the ambulance to drive you up there. And then at the border, the Red Cross or the Ajo ambulance service will come and pick you up and take you wherever you got to go. You either have cash, the Ajo ambulance company will take Medicare, what other medical billing insurances you have, they take that too. So once you hit Medicare, you're going to be okay. There's probably still going to be a copay that you might have to pay for that. If it were my choice, I'd go there and tell them to take me to the VA, and I could either go to the one in Tucson or I can go to the one in Phoenix. But since I have Medicare, I can go anywhere I want. With that said, Ajo has a medical clinic down there. I can't remember the name. And they take Medicare patients. It's a 2-hour drive. Much better than having to go all the way up to Phoenix and Tucson or wherever else to go. You can establish a relationship with a doctor in Ajo. Go up there, get your shots, get your physicals. And of course, they're going to refer you out to things, maybe like x-rays or whatever else, and that puts you to where you have to go back up to Phoenix or Tucson or whatever. I know they send out for a lab, so they can do a blood draw and they'll send their lab out. So that is a pretty good option for you. Now, my insurance agent understood that I research everything. And I understand what their motivations are, and she was really good at not trying to push something on me that I didn't think was good for me. And to let you know what that's all about is, an insurance agent will get, I think in 2023, $631 commission to sell you an Advantage plan. They're going to get, I think, around half of that to sell you a Medigap plan. So we're up to about $1,000 in commissions for that salesperson to give you Advantage and a Medigap plan. That doesn't include drugs. That's another commission they wind up getting. I don't begrudge them that. They're working hard. They're representing you. I'm just giving you the numbers. My agent did not attempt to push anything on me that I didn't want. She gave me exactly what I wanted, and at the end of the day, the only thing I bought was the drug plan from her. And I'm sorry for that. Nice lady. professional. Gave me what I needed to know and no more. But you do need to understand that as you're out there researching, because you see something coming across the TV, you need to call now, you need to check on this, you need to do everything right now. You've got sales agents at the other end that are wanting you to buy something because it's a high commission for them. And like I told you, with the Advantage plans, it's not a good fit for me. Maybe it will be for you, but it's not for me. And understand that the federal government is investigating them right now because they're refusing claims that they shouldn't be refusing. Anytime I've got somebody else that's got their fingers in my pie, I'm not going to feel real comfortable about that. I want to be able to make the decisions I want to make. And I feel with Medicare and the VA, I've got those decisions. They may still tell me no about things, but it's what a doctor's for. I got to listen to them, and then I have to use common sense. And that's really kind of the clue on all of this. Use common sense, research, ask questions, pay attention to what's going on. So what's the important takeaway from all this? Well, if you think you're going to get health insurance and come to Mexico and have health insurance take care of anything you have going on, that's just not going to happen. I don't know that there's a policy. I've researched, I've asked questions that the Mexican hospitals would take. I don't think there is. You can read stories where people have been treated in emergency circumstances, and unless they can pay cash, the hospital's not going to let them go. They keep them in the hospital until they pay. There are stories here that if tourists come down here and they owe a vendor something, whether it's bogus or not, then the police are going to come and take you to jail. So you're not going to have medical insurance down here, and you're going to get in trouble if you try to go get treated and you can't pay for it. Just be aware. Now, because I'm an hour closer to the border, it makes life pretty easy for me. But if you're further down into Mexico, you don't have as many choices as I do. Now, talking about insurance, the rule here is that you have to have automobile insurance. You can buy that at Costco. You can buy that all kinds of places. I and many of the expat community choose to buy from Alejandro, Portugal, which is an insurance company down here. I pay $100 a year, and they insure my license, not the vehicle. They insure my license, which means I can get in anything I want, drive away, and I'm insured. $100 a year. Can't beat it. I like it a whole lot. So, if you're thinking about coming to Rocky Point and you're hoping that everything's going to be covered, it's not. You're going to have to do some research. You're going to have to make some decisions. If you are someone who's got lots of medical problems, you may want to consider not coming here. I guess it could be dangerous for you. I'm going to give you one more story and then I'm going to sign off. I have a friend, neighbor, who got into a kerfuffle one evening. We're not really sure what happened, but his leg was broken badly. The next morning we were able to get him over to the Red Cross, and then a doctor saw him, and the doctor determined that the break was so bad it would be inadvisable for him to be moved via ambulance up to the border without medical assistance, I guess. And so they were going to medevac him out, and he had a pretty good job, great insurance, or I'm sure they never even would have made arrangements like that. My friend and I escorted him up to the airport here, which, by the way, is pretty nice. And because he didn't have a visitor's visa or a permanent visa, they couldn't fly him out. I know that's going to sound weird to you. You can drive into Mexico and hang out here without a visitor's visa and nobody's going to say much to you, but the reality is the law says you have to get yourself a visitor's visa, and then come and go on the land. But if you fly, when you land at any of the airports, you're going to get a visa. You're going to present that on your way back out. So he was at the airport waiting on the tarmac for hours, and we were waiting there with him until immigration came, got him a visa so that he could fly out of here, and off he went. Now, he got back up to the United States, and when I talked to him later, the bill was over $250,000. Well, that was no longer his problem to deal with. That was the insurance company and the medevac company to deal with. Those two are going to negotiate back and forth on what they're going to wind up paying for that particular service. $250,000. What if he didn't have that? He'd have to take that ambulance trip up to the border, and then another ambulance to transfer and on to wherever he's at. And maybe the femur could have cut a artery. Who knows? Don't know. The moral of the story is that you got a lot of choices to make. Maybe coming here is not one of them, but if you take reasonable care and you're able to get yourself up to the border for anything that's catastrophic, you're probably going to be okay. So that was a boring, extraordinarily boring story of my journey on insurance. The reason I told this story is that I've seen some people asking questions and misunderstanding what the insurance system is all about and what they can expect when they come down here. That's what you can expect. Get your own insurance, expect to pay cash otherwise, and if you're going to have a catastrophic event, you're going to have some problems that you're going to have to deal with. You'll have plenty of expatriate insurance companies that are willing to sell you a policy. Will the medical facilities here accept them? Probably not. Will they reimburse you after the fact? Maybe. Again, insurance companies like to be able to decide what it is they're going to pay for in advance. Things they can approve or not approve. So, I hope that was helpful. If anybody has anything to add to this, by all means do. My advice to you is stay as healthy as you can. Don't do things that are going to harm you short and long term. That's pretty much it.